show the audience members.
Back here at Lambeau Field, the score that surprises many. Indianapolis 24 and Green Bay 10.
Okay. So my topic is over lung cancer.
Game began with fireworks.
Alright, so only 13% of lung cancer patients live as long as 5 years after initial diagnosis. Because of this, everyone needs to be aware of this disease so they can prevent it. I have seen the effects of lung cancer firsthand, and it is horrible. I've also had the disease in my family, which therefore gives me credibility about discussing it. Lung cancer is the most fatal cancer in the world, and I will be speaking to you all about what it is, what causes it, and the effects it has on the body. First, let's talk about what lung cancer is. Lung cancer is diagnosed as an unconditional growth of abnormal cells in one or both lungs. There are two main types of lung cancer: non-small cell lung cancer and small cell lung cancer. And according to lungcancer.org, non-small cell lung cancer accounts for 85% of lung cancer patients, and small cell lung cancer accounts for the remaining 15%. There are three types of non-small cell lung cancer: adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Non-small cell lung cancer has 4 stages. Stage 1 is cancer is only in the lungs. Stage 2, cancer is in the lungs and in lymph nodes. And stage 3, which is the beginning of advanced stage lung cancer, is in lungs and nodes in the middle of the chest. Stage 4 is also an advanced stage, and it is in both lungs, fluid around lungs, and or another organ. The stages of small cell cancer are limited and extensive. Limited is cancer is found on one side of chest, and extensive is spread to other regions of chest and other parts of the body. Now that I've talked about what lung cancer is, now I will talk about what causes it. There are a few ways lung cancer is caused. The number one cause is smoking tobacco. Also, there are secondhand smoke, which is someone inhaling smoke from someone who is smoking. Air pollution, such as smog, which is in overcrowded cities and countries, and China and India have a major problem with this. Chemicals in the air, such as asbestos, coal products, and mustard gas, and many more. And a family history of the disease could increase your likelihood of getting it. More on tobacco. According to the Handy Anatomy Answer Book, toxins from smoking can damage the alveoli, which are located in the lungs, and can cause them to leak and pop, which hinders oxygen flow. Oxygen that is inhaled is diffused through the walls of the alveoli into the red blood cells, which is why the alveoli is important to breathing. According to WebMD, there are 4,000 chemical compounds found in tobacco smoke which have been shown to be cancer-causing. Asbestos are tiny hair-like fibers found in some types of rocks. It is a natural mineral that is fireproof and insulating, which is why it was used in building material. Many workers inhaled this, which irritates the lung and causes lung cancer. Secondhand smoke. Research has shown that non-smokers who reside with a smoker have a 24% increase for developing lung cancer than someone who doesn't reside with a smoker. Now that I've talked about what causes lung cancer, next I'm going to talk about the effects it has on the body. Signs and symptoms vary at different stages of the disease, but according to the American Cancer Society, most lung cancers do not cause any symptoms until they have spread, but some people with early lung cancer do have symptoms. Symptoms that are from the chest signify the cancer hasn't spread. These can be coughing, pain in the chest, shortness of breath, hoarseness in the voice, harsh sound of breathing, bronchitis, pneumonia, and coughing up phlegm or blood. Symptoms that occur elsewhere in the body. This may be a result of the cancer spreading from the lungs, and this could be loss of appetite, weight loss, fatigue, general weakness, bone and joint pain, muscle wasting, bleeding, and blood clots. These symptoms can happen to anyone with lung cancer, and by not discovering it quick enough can lead to more harm. The survival rates decrease as the cancer stage level increases, and the survival rates vary. Therefore, they can only be used as an estimate to how long the patient will live. To restate my first main point, according to the Handy Anatomy Answer Book, only 13% of lung cancer patients live as long as 5 years after initial diagnosis. In conclusion, you have learned about lung cancer and how it affects many people. Lung cancer has the highest mortality rate amongst all other cancers in the world, which is why I wanted to make everyone more aware of it in order to perhaps prevent people from getting it. I have now described to you what lung cancer is, what causes it, and the effects it has on the body. And remember, lung cancer is no joke, and it is the deadliest cancer for a reason. Everyone needs to remain aware of it and learn from it in order from getting this cancer.